This just in, breaking news reporting. A cruise liner 30 miles outside the Corpus Christi Bay has capsized, spilling its occupants into the water. Hundreds of casualties have been reported, with all available rescue teams bringing patients to nearby hospitals for treatment. Family and friends of possible victims are being instructed to avoid congregating in the hospitals due to incoming rescue vehicles and space needed for patient treatment. Instead, we ask that you wait for further clarification and instruction. We'll continue reporting as more information becomes available.
So in this part of the video, we're going to focus on triaging our victims based on the level of care they need as they come in from our boat crashes. Each card represents a different priority level based on the injuries that they have. So in this case, we have the black card. So let's go take a look at what medical injuries they have. So this patient had a crushing head injury and a crushing chest injury. They have no pulse, no respirations. So at this point in our care, we're going to go focus on other patients who have a better chance of survival and require a priority medical care. Before this, we went over the patients who had the black card. They were already dead or they're dying. So now we're going to go over patients with the red card. These patients have life-threatening injuries that require immediate attention. So we're going to go take a look at what injuries this patient has. So this patient suffered a spontaneous pneumothorax from a chest-crushing injury as well as an above-the-knee amputation. So based on these injuries, they're going to require immediate care, whether it be medical or surgical. Previously, we saw the patients with the red card who required immediate intervention because their injuries were severe. Now we're going to take a look at the yellow cards who require attention, but their treatments can be delayed 30 to 60 minutes. So we're going to take a look at what injuries they have. So this patient sustained an eye injury as well as a leg fracture to the femur. So although these injuries can lead to further complications such as loss of the function of the right eye as well as possibly a pulmonary embolism, we need to treat our patients with the more severe injuries with the red cards before we can come in here and treat the patients with their injuries. So now we're going to take a look at our patients given the green card. These patients are usually our walk-in patients, and they normally come in with minor injuries. So we're going to go take a look at what injuries this patient sustained. So this patient came in with a wrist sprain as well as an abrasion to the arm. So although this patient is going to need our care, we can see him at a later time after we address the need of the priority patients first.
Sir, can you help me please? I'm trying to locate my sister. I can't find her. I know she was on that boat that crashed. Please help me.
All right, well, I don't have any information for you right now. We have all of our staff already hard at work to make sure all our victims from the crash are being treated. But we do have a designated waiting area, so if you give me your name and some of your information, whenever I do find out, I can let you know. So follow me to come to the waiting area.
Thank you.
I know this is such a traumatic,
Okay, so one of the most overlooked aspects of mass casualty situations is the family and friends of the patients. So what we want to do is provide an area for them to congregate while everything's getting figured out. Now, we did have things like on the news where we said, don't go to the hospital because of the rescue vehicles and all the patients coming in, but it's inevitable where people are going to show up because they're worried about their family or friends who are on the boat. So the first thing that we want to do is have a designated waiting area. A place for all of these people to go that's out of the way, that it's safe for them to go to so they're not in the way of anything. And that way, if any information becomes available, we know where everybody's at and we can go give them that information. We also want to make sure that we're doing proper RN and physician delegation. So for instance, if we have someone in the waiting room and we know that their family member or friend has died, we don't want to assign a UAP or a tech to go out and talk to these people. We want to make sure that it's the physician who's going and breaking the news and that the RN is present for the therapeutic communication, because you have to be properly trained in those areas to deal with those situations. Lastly, we want to make sure that there is an orderly way to deliver the news, whether it be a spreadsheet or a list. When we get the patients in and the information available, we want to compile the information and have everything as organized as possible, even though it's a pretty chaotic event. That way we can deliver news to the family and the friends in an orderly manner. We also, just some things on the side, we want to make sure that chaplains are available, that any sort of aid is available for these people as far as grief is concerned or things of that matter. And we also want to make sure that we have designated breakout rooms. Maybe having this big waiting room available to break the news isn't the best situation. So we have them all in the waiting room, and then we can pull family members and friends one by one into designated rooms, and the physician can break the news, whether it's good or bad.
So, are you experiencing any pain right now?
Yes, lots of pain. I'm having lots
Alex?
of pain about.
Hi,
Good,
sorry
one
to interrupt
second.
you, but can I talk to you for just a second?
Oh, yes, you can. All right, well, we'll be right back to take care of you, okay?
Okay.
And the door's closed. Hey, Alex, I've noticed that you've been here for like 48 hours. It seems like I haven't seen you gone home. Have you had anything to eat, or have you slept at all?
Oh, no, I've taken a couple naps, but they've been very short, and I've been eating and when I can, and then drinking some coffee to make sure, I'm staying awake.
Okay.
But I'm just here trying to care for all of our patients.
Right. Well, hey, look, I really appreciate how hard you're working, and I know that you want to be here helping these people, but at this time, I'm going to have to ask you to go home and get some sleep. Okay? I need you to tell the charge nurse that you're going home so that we can get someone in here to swap your shift. And I know you want to be here, but we really need you to be rested so that you're doing what's best for these patients. After a while, even though you may not feel it, your judgment can be clouded a little bit just from how tired you are.
Okay.
So I want you to be able to go home, get some sleep, and then we'll call you back up whenever we need you. But it's under control.
Okay.
If you're too tired to drive, we have cots here that you can sleep in, or you can have someone come pick you up. Do you have someone?
Yeah, I have my wife. She can come pick me up. I'll go talk to the charge nurse, see what he wants me to do.
Okay.
But yeah, just give me a call if you guys need any more help.
I
I'll be
really
glad to help.
appreciate it. Okay.
All right, sounds good. Thank you.
Drive safe, man. Okay, so again, one of the most overlooked aspects of mass casualty situations is the staff itself. We tend to focus on just the patients, but it's important to keep in mind the people who are working the situation as well, whether it be RNs, physicians, techs, respiratory therapists, everybody that's involved. We want to make sure that they are getting the adequate sleep and nutrition that they need to provide the best care possible to these patients. If these nurses are here for 24, 48, 72 hours, their vision and their judgment is going to be clouded, and we don't want that. So what we want to do is make sure that if a mass casualty situation occurs, that there is a schedule in place for shift swap. People are coming in, constantly refreshing each new member that comes in, so that way fresh care is being given and a new set of eyes is on the floor at all times, just to provide safe care to the patients as a whole.